Aloha and welcome, and thank you for joining us this afternoon. We are going to start this next episode of Ask-A-Kauka in just a few minutes. We'll let a few more people trickle into the room while our guest speakers get ready to talk stories from the field, what they're seeing out in the communities, in the hospital, ERs, what they're seeing around this pandemic. So stay tuned. We'll be with you in just a few minutes. Aloha mai kako. Mahalo for joining us this evening. We've got another great episode of Ask-A-Kauka. Tonight, stories from the field. We've got Dr. Deanne Carpenter, who will be moderating for us this evening. We've got some great doctors. One hasn't joined us yet, so we'll give him a call, make sure he does join us. In the meantime, aloha and welcome. This webinar is presented by Papa Ola Lokahi, the Association of Native Hawaiian Physicians, and the Native Hawaiian and Pacific Islander Hawaiʻi COVID Response, Recovery, and Resiliency Team, in collaboration with NCAPIP, that's the National Council of Asian and Pacific Islander Physicians, and Papa Ola Lokahi. Support is being provided by CDC and the Walmart Foundation in partnership with Urban Institute and the Asian American and Pacific Islander Health Forum. Tonight's webinar is being recorded and live streamed on Facebook with several cross-posting partners. Mahalo to you all. We invite you to post your questions for the docs in the Q&A panel below. Please complete the survey when you leave the webinar, and those viewing on Facebook may post questions in the comments section. I'd like to introduce to you our moderator for this evening, Dr. Deanne Carpenter, an internist, associate professor at the Department of Native Hawaiian Health at the John A. Burns School of Medicine, and past president of Hawaiʻi Ona Kauka. Aloha, Dr. Carpenter.
Oh, aloha mai, and thank you all of you for joining us today. I have the distinct pleasure of inviting our panelists today, and hopefully Dr. Gerard Akaka will pop on in at some point this evening. Otherwise, Dr. Kaohimanu Dang Akiona, we are going to hear from you. And, you know, I want to call you Dr. Dang because that's what I knew you as before you became Akiona. So if that's cool with you, yeah, okay, mahalo. So exciting to have you on. You are the primary care physician in family medicine who manages the premier medical group in Hilo and Kona. And so because of that, I put this on for you. And because I'm from the Big Island, so we have our background of Mauna Kea and Mauna Loa. You can't see the other three, but I thought I'd honor you with my background here. And then just really all the things that you've been doing on the Big Island. So proud of you. And I also want to mention, so exciting that you, and part of Papa Ola Lokahi years ago, was a Native Hawaiian health scholar. So really welcome to this panel. We really want to thank you for being here this evening on our Ask-A-Kauka and really kind of sharing your stories from the front line. And I know, because we've been conversing by text, by phone, and so I know you have so many stories that you can share with us this evening. Before we get started, I wanted to actually ask just, maybe some of your mentors who actually brought you to this place. And the reason why I bring that up, because Gerard Akaka was actually one of my mentors. So I thought maybe we'd start with that, and then you can share a little bit more about what we'll talk about this evening. Mahalo.
So, good afternoon from Mokuokeawe. I'm sitting in my beautiful office in Hilo. It was pouring earlier. I think it cleared up, but yeah, no. I'm so thankful to be here and grateful to for the invite. It's been kind of a full circle moment because like 20 years ago, I was a Liko Noelo at Imihales. They call us the little budding researchers at Imihale and got engaged in a lot of the community-based research there and was mentored by kind of a lot of mana wahine from when I started at the university. So I mean, so Deanne Carpenter is one of my mentors. I was raised by just these group of people who are now they're leading things, and so like I think I see Dr. Kamaka on, and she's one of the people that kind of helped cut as I grew, and Joanne Sark and Catherine Braun and Marjorie Mao, all the women that I look up to that are now colleagues with me. And so, I am a Native Hawaiian health scholar. I came on in 2009 and then went away for medical school and came back to the Big Island because this is where I knew I was going to be. So I'm happy to share whatever I can because we've been doing this for a long time, and I'd like to give voices to the people from the neighbor islands because they need to, it's good for everybody to hear, I think, what's going on out here too. Hi, Dr. Akaka.
Mahalo nui, mahalo nui. Aloha, Gerard. So nice to see you, Dr. Akaka. We were just trying to kill a little bit of time so you can pop on in, and wanted to just introduce you as internal medicine Vice President of the Native Hawaiian Affairs and Clinical Support at the Queen's Health Systems. And I actually mentioned right before you came on, and we were just asking maybe how you actually came to be in your place, and how your, who are your mentors that brought you there? And so I wanted to mahalo you for being one of my mentors that brought me into medicine.
Okay, thank you. You know what? Honestly, I think it's a God thing that I'm here as a vice president. So I started out like many of you and us. We just want to help, right? We want to help people. So we do this journey into pre-med and medical school, IMI for me, right? And such in hopes of helping and serving as many people, and of course Hawaiians. So my journey took me from residency into the U.S. Air Force for 3 years, and then I went right to Waianae Camp for 8 years, and I became the medical director there. So, and then I was called to the Queen Emma clinics here at Queens, and I've been here ever since. And that is like 19 years ago now. And I'm not sure how I got to this vice president role. I don't know if I deserve it, but I tell you this, I just try to serve the best that I can, and step out and sacrificially serve if needed. Yeah. So I don't, that's it, I think.
Oh, mahalo nui for sharing that bit of yourselves in coming here. And again, we really want to get to the heart of the matter this evening and really talking to people about some stories from the front lines. So I'm just going to throw it out there, with our first question, really. How have each of you been addressing COVID-19 in your practices? So not sure who would like to go first, but either one of you.
Can let the young ones go first.
So, Dr. Dang Akiona, I know you have some slides. Would you like to put them on now, or
can go through them
later?
Really
yeah. Yeah, because I think that might actually lay down some groundwork, and then we can have Dr. Akaka speak to that in regards to what he's doing as well. So yeah, let's go ahead and have you share screen then.
Okay, I go to share screen here, and I'm going to share my summary. I just had to, well, I've been having to summarize a lot. And I think for Premiere, we got started. I think I got to talk one time before about how many changes we've made. So right at the very beginning, we actually immediately changed a lot about our clinic, and we kind of revamped a lot of what we did. And so what we've done for the past 18 months is really continue to provide primary care throughout the pandemic. And that's been kind of the challenge, I think, in general, was just how to, sorry. There. How to continue the services, because we're always trying to, as primary care, we always want to make sure we're leaving things better than it was before. And so like I can, when I had to summarize exactly what it is that we've done, so we've had to basically be the informed expert in the room and essentially crunch down like 8 years of all of our training into like 4 paragraphs, which is pretty difficult, right? So we were covering COVID epidemiology stats, explaining about variants in viruses. We were talking about different types of testing and vaccination. And really in my brain, it was always about accountability and equity, because I'm always trying to think for the Hawaiians, this means like, this is us. This is like live or die for us. This is like, we don't want to get left behind. We're not going to get left out. So I was always thinking about that, and then really just trying kind of guiding from the small to the big. So your personal risk mitigation stuff, and then what are the different guidance that we could offer for different settings. We really approached this in a multitude of ways. We were looking at that steady focus. So I would advise like kind of where we needed to watch all the time, and then how do we shift it, and where would we anticipate problems? How do we plan and basically do disaster preparedness? And then we were equipped to provide care in a variety of settings. So both across the nation, across our county, across our state, in the bushes and resorts, all kinds of things. And we really actually kept seeing patients. So as primary care, seeing babies and old folks in all settings. We have something called Palikana, which is a 24-hour treatment home. I was doing street medicine at the homeless. We're still seeing work comp and telehealth. And what we did was we tried to make sure that we were keeping an eye towards the safety of our own team, because we knew we were putting them at risk. So the idea was behind our team, and this is a Dr. Miskovich thing, is you do what you know is right. And so really, you're trying to, when we're looking at what we're grounded in, it was the idea of community, that we're providing this with compassion. We are always like trying to do it with integrity, and we treat everybody like we would our own family. We didn't get any private funding. We didn't have any federal sponsors. We didn't have any special grants. And that was part of the challenge for us. So we really did. We reached out. We did as much as we could as a community-based and focused family medicine. We were trying to bridge that gap between what people thought was happening and what was actually happening. And so I was boots on the ground in the county, kind of telling them, this is what's actually happening, what's actually making an impact and not, and then trying to synthesize all the time what the most up-to-date evidence-based stuff that was happening, and how do we translate it into what we're doing in the field. And so really this was my life for a year, was just all the stats, really looking at frameworks and models that work to address all of the tiers of risk that we had here. We made sure we're bringing the care to the patient, because on the Big Island, the biggest thing is going to be geography. And we tried to be super nimble and a self-contained kind of response team. And that's actually where we've succeeded the most on the Big Island. And then really just kind of making sure that we're being aware of the personal and professional risk mitigation. So we were trying to be as well-rounded as possible. I think Dr. Miskovich and the team in general, we've always I don't know if you can see, but the picture on the right, his son is kneeling next to me, and his son is in the physician assistance program on Island, and his daughter is right next to him. And so like the family was always working alongside us. We always had those 2 nurses that are next to Dr. Miskovich were volunteers first, and they came from the hospital, and they often brought their family members, their daughters, and their family members to help. And that was part of the outreach that we had, was just people bringing their families and reaching out into the communities that they knew. So we made it a point. We weren't as good about this, but now we're explaining that we really do know testing, and now we know vaccination as well in a variety of settings. So my practice is really based in vulnerable populations. So we're, I focus on street medicine, homeless shelters. A lot of those tend to be, they skew more towards my demographics. So they're more Hawaiian, they're often young, and a lot of them have comorbidities. But we also did large sports conferences, big fancy stuff. We did return to work for Disney, other movie studios, and we were able to work across the states. So a lot of what we did here on the Big Island actually informed a lot of the COVID response on the mainland. And that was I thought it was a moment of pride for Hawaii County, that we were showing that you could take some idea and do it in a variety of settings with a variety of different types of broadband capabilities. And it actually helped New Mexico and Arizona and Georgia and Florida. And they actually used our approach to roll out their vaccination program. Well, it was still under Premier, but in Pima, Arizona, that really focused on, we were focusing on the most vulnerable and the people that are often left behind. And so, we really take pride in that we get to know our community. And, my success is really because we team up with great people. So the paramedics, the first responders, all the people that really know where the hotspots are in their community, the weaknesses, the problems, we got in there. So there's the top right picture, that's actually King's Landing. So there's a nice little group of people that are unsheltered. And they were one of the first times we tested on the streets. And they, we do some education all over the place, homeless shelters, Hire is one of the risk reduction shelters, and then up in North Kohala. Again, approached everything like with multiple layers. So it was always that steady focus. What are we kind of keeping our eyes on? How do we make sure we're always leaving things better than before? Because that was always our thing, is that for primary care, especially, we want to be contributing in some positive way. So we're not just a shot in the dark and then gone. And then, keeping in mind that we always had to anticipate the plans, and then kind of just always keeping a pulse on the read for the community. We were always shifting, and that was kind of what's been happening, what's led to us where we are today. So we did very large scale testing. We were the first in the state to do the large scale drive-through testing on Oahu and in Maui County, Honolulu County, and Hawaii County. And we focused on where there was need. Additionally, we were asked a bunch of months later to stand up airport surveillance testing, which was, as a doctor, I can tell you it was a logistics nightmare, but we did it. So post-arrival testing, we coordinated with County Civil Defense and Department of Health. And for 6-7 months, we met every single person that came through the Kona, Hilo, and Waimea airport. And we figured out a way to get everybody through and tested, followed up, contact tracing, and everything like that. And we also helped support the state safe travel. So all the people that were randomly selected could find a site, and we would test them as well. So that gave us an idea of what was coming into the state. And then in the meantime, we were actually so what our claim to fame is that we've been able to mobilize testing ops teams. So we're self-contained, and in less than 24 hours, we can give you a plan and show up and do aggressive testing to contain clusters. And so we first had to test this for Kona Community Hospital when they had a few positives, then the dialysis unit here in Hilo and on the Big Island. And then probably our biggest project that was hardest for us was Yukio on island. But additionally, Doc's been doing a lot of the Oahu care homes. And so that's been part of our focus, has been just this nimble, quick cluster. It's like we call them our strike teams. So we have strike teams that are scalable depending on what happens. And then all of our brains are behind it, always trying to keep things going. And additionally, we just kind of made sure we had that safety net support. So we were 100% trying to support as best we could what I call medically adjacent service organizations: Food Basket, Hope Services, Care Hawaii, people that are doing outreach, crisis management, all the services that you do not want wiped out. We would try and support them the best we can. We were on call for them when there was problems. We would advise whatever needed. We did support UH Hilo. As a small school, it was really hard because they had like very small budgets. So we tried our best and kept their sports going. And then just the general community. So, we are one of the most well-insured states, but the access to primary care has been awful. So we were just there. If you just needed help, you could call us, and they took us up on that. And, again, we were always in the meetings. We tried to be always at the table, tried to make sure that we were always sharing best practices, that we're advocating for the best possible quality stuff, and that, no cutting corners, especially in Hawaiian Homestead and on our island. And I kept seeing patients, so I was still seeing regular stuff. So right now, we are still doing regular and mobile testing and vaccination clinics. We have regular rural routes on Mondays, Tuesdays, Wednesdays, our shelter days, Fridays, and Saturdays. We do in-home vaccines, and we still take primary care referrals. We started rolling out Regeneron as an in-home or in-field treatment. We kind of got our supply cut off by a recent change in the federal government. But again, this was really because our hospitals have been over capacity on island for over a month. And we were trying to do what we could on the outpatient side to directly address the barriers to care and the barriers to clinic-based treatment that we know is going to come up. And we continued standing surveillance. So we still do crisis workers, shelters, schools, communities, and sports. We're still expanding or holding course our primary care. I'm doing a lot more business support now. So the vaccinated and unvaccinated, how do you maintain your services so that your workforce stays healthy and your services are uninterrupted? So like, for example, a few of the businesses took proactive approaches and really invested in their folks. And then some, like the resorts, they're offering vaccination on site so that they could at least support that, and then trying to figure out the testing side of things. And then we consult regularly to help with the work safety programs because COVID is not going to go away. And then, every week I talk story with Micah, Alameda, and Naleo. And so I think in general, when people ask me for my take home points, it's basically like really, 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 really important to have the right experts at the table. And I can't stress that enough. The biggest thing for us has always been time, access, and equity. So a quick response, you have to make sure that everybody truly has access and that we're actually considering the people who cannot. That there was no such thing as when people were quoting me, oh, there's overlap, we're overlapping service. There is no such thing. In some places, resource poor as we are, that's not a good excuse, and that there was always a lot more risk than we wanted to see. I had to tell the community it wasn't about that we're ever going to get to zero infections, but that everybody was equally prepared for when the infections came. And I think that's been the hardest part. With the virus, no us, there is no us and them. It's all of us. We're all exposed. The take home that I've been having over the last 2 months is that we all needed education support and people needed to be seen. And that was the hardest part, I think, for the rural people, was understanding that they deserve better quality and that they can ask for it. And then for me, the bottom line for us has always been that if we're able to really improve the care and the access and the health of the most vulnerable and marginalized, the entire community just gets better. And I know that's a hard sell, but I mean, I think that's the reality of primary care is you really, really, really make a difference. If I can do it for the hardest to treat, there kind of is no excuse for us not to help the rest of them. My take home, I think I've been getting the ask from community organizations, what can we do? And it's always been about education, just whatever we can do to improve better education, because the education and the health will follow. Really educating others. And so making sure that, I tell people when I'm spending time with them, like, go ahead and share that with somebody else now, because it's ridiculous how isolated we can be without really realizing it, because we got used to not having good care, good access to care. And then for us, it's been kind of making sure that we're including the physicians and really advocating for them to get re-engaged in this whole process, which is very frustrating. But I mean, they're the ones that are seeing the pukas. My dialysis guys, they know where the scary parts are, and it's just re-engaging the care community again. And so that was my summary. I can stop sharing screen now, yeah.
Yeah, mahalo nui.
Sorry.
That was huge, Dr. Dang Akiona. Sorry, I'm still not used to your entire name. That was a lot. And I mean, to me, you're Big Island, and therefore you have to go big or go home. So I like that. I heard a lot of really great stuff. And I'm thinking that, it sounds like you are really taking care of the entire community. And I mean that in multiple levels. So that's happening on the Big Island. Maybe later I'll ask you to talk a little bit more about your unsheltered communities. But right now I'm going to ask if we can maybe move on to Dr. Akaka and see what's been done at our big triage hospital and our Queens health systems, which actually go throughout the state. So Dr. Akaka, if you can share with us, that would be wonderful.
Yeah, mahalo, Dr. Carpenter and Dr. Dang Akiona. I am so impressed with your passion and your energy and your positive attitude, and actually what you've done with a relatively little resource, but you just go for it. So, man, that is good stuff. And so thank you. What we've done at Queens, and we're in a unique position and a very, I think I'm so honored to be there, because at Queens we've received a lot of the sickest patients, and not surprisingly, ones who need to be on the ventilators, very few on ECMO. And so that's total life support in order to save the life. If we're talking about stories, I'm not in the trenches like our ICU nurses are and our wonderful hospitalists are, but I tell you, we owe them so much gratitude because they're working hard and they have to deal with well, they have to share some of the sadness with the patients. And I'll put it this way: if your ohana cannot be in the room with you, what is that, right? You have to, the next best thing might be an iPad and you kind of having a FaceTime conversation. Can you imagine your loved one being in the room? You cannot be there while they pass away. The sadness, the awe and things like that. But that's the things that they had to deal with. And other stories are like that too. It's like, and I shared this before, young couple in their 40s, they took a trip, took the kids, was at Disney World, came back. Wife was a little sicker, the husband was okay, but the husband got sick. And he ended up passing away. And this was after an innocent and, a family visit, a time to refresh and trying to get back to life. And then there are other sad stories of Tutu. You know how the grandparents take care of the grandchildren, right? So often because the parents have to work and such, but in this case, the grandmother got sick and she passed away. And so I would say this early on, that the message from Queens is to know that the surge, and even now, it seems like after Labor Day was a little quiet, but we're seeing some things on the west side too. The Queens West Oahu ED is starting to get hit hard again. So the thing is, the first thing, the surge is for real. The second thing, get vaccinated. The next thing is stay home so you can keep the isolation. And the fourth thing, I guess, would be, Queens is here for you, because I tell you, we've been doing lots of preparation if we have to scale or expand our ICU, because there are a lot of ICU patients coming in, then we've done that already. And things got quiet, so we kind of started to get back to normal. But if the need arises again, then we want to be there to support as many patients as we can. I would say in terms of story too, there was the oxygen conservation. And the thing is, and when people get COVID sick, so many of them are in the hospital because of the respiratory issues. Their oxygen saturations drop too low. And for those who are non-medical, if yours and mine oxygen saturation are in the 98% range, almost 100%, then for these people, drops to like 80%. It's very low. And I'll just tell you, and the physicians would know, for our COPD emphysema patients, we give oxygen when the saturation drops to what, physicians? 88%, right? That then we can justify the oxygen. We get COVID patients dropping lower than that and staying low like that. And after a while, that's not good. And of course, it can be life-ending to have that. So again, I just share that to encourage people, if you haven't gotten vaccinated yet, please get vaccinated. If you need to talk to people about, you have concerns or you're not sure, and just, a little talk with somebody you trust might help, then please reach out to them. I think that's it. Lots of work at Queens. We're doing the regen COVID as well, the infusions, and we're trying to increase that to cover at not only in the at our Queens Punch Bowl campus here in town, but also at West Oahu and at North Hawaii, as well as at Molokai General. We do the vaccination outreaches. We collaborate with Hawaiian serving organizations and as much as we can, and the community organizations. And actually, that's one of the good things that come out of a bad thing, which is COVID. It pushes us to work together in ways that we wouldn't have done it before. And we've developed such wonderful relationships with other entities, and Queens can be one of the partners carrying the load instead of just being Queens, right? But getting into the community is a good thing too. We try to, or we're working to support the other islands too, neighbor islands and the other hospitals here. If there are medical conditions they cannot handle because they don't have the specialists or the staffing to do that, we try to be there to support them as well. So, many changes. And I would say this, that I appreciate our nurses and physicians and the respiratory therapists. The folks, the physicians who have been in hospitals know they are really the front-facing staff who really hold the hands and comfort the patients with COVID, Hawaiian and all ethnicities. So I have so much appreciation for the frontline staff. And then there's the ones out in the community, like Dr. Dang Akiona, critically important frontline staff. And I just am so appreciative that neighbor island, and then on one big island to boot, and you stay facile and you can pivot real fast, which is very important and appreciated too. I'm sure there's similar on Kauai and Maui as well, and Lanai too, but I think it's all pulling together to do that, and Queens wants to be part of that. And for the difficult cases, we know we're going to get it, but we want you folks to be reassured that if needed to send them here to Queens, that, or I want to let you know we're trying really hard and extending ourselves to keep those beds open for you folks.
Oh, mahalo nui, Dr. Akaka. It's just so heartwarming to know that, that all of the things that Queens is doing to really increase the amount of ICU beds, in opening up cases and places that you can put patients who are really at need, and to go from being on the front line and trying to prevent that. So both of you actually talked about an IV medication, Regeneron, and that medicine is actually, maybe one of you can tell me just a little bit about it and how and who actually gets it in order to prevent a hospital stay. And I do know that there's a shortage. So if you want to address that, I know, I'm sorry about the eye roll, that's true.
Oh, no. It's so, we were banging our brains again because we were just kind of trying to figure out, look, so it's been over a month where I've been having to have my regular care patients have to get, either divert, they can't go to the hospital to get their care. We had a brush fire and I had a bunch of COPDers and just regular standard care we couldn't get anymore because we were full. And so, it's one of those, Dr. Miskovich and I were just kind of trying to figure out what we could do. And then we're like, so we started ordering directly. So we started talking about Regeneron because you can do this as 4 subcutaneous injections. And, versus the IV infusion, which is perfectly fine. And we can start IVs, but in the field, 4 subcutaneous injections is really, really good. It's large volume. So it's 2.5 mils times 4. And I was putting them in the arm and the belly. And before, when we thought, okay, so we could order, we ordered 120, it came, and we're thinking, okay, this is something that's pretty stable. we're going to start with the positives. And so, in the field, I get rapids. So I do the rapids on people who are symptomatic or had close exposures. The idea being that we get the BD rapid and then we confirm it with a PCR in the field. So there's VISBs and there's ACULAs. There's
I'm just going to translate really quickly what you're just saying.
Testing. So we're going to
thank you.
Yeah. So testing in terms of like that rapid test, we're going to confirm it with an actual PCR test, which is the one that people need for the confirmatory stuff. But we do carry them. We don't use them broadly, but we have the ability to do it in the field as well, rapid. So 45 minutes or 30 minutes, confirm it, and then we could treat them right there, because these are the people that we are anticipating going to need the hospitalization down the road. We can monitor them because I have my nurses on site. And so ideally now we're like this mobile field testing. I mean, at the same time, we do the education, we get the testing, and their family members can get vaccinated, or we can set up whatever we need to in the future. Now, what happened was, a lot of other states needed this as well. So everything's getting funneled through the feds, through FEMA. And my big thing, and I think this is really nice to have Queens on, like a Queens representative, is that when people say we have a FEMA site and it's at the hospital, it means a different thing for the Big Island, because, putting something at the hospital doesn't mean it's going to get into the arms or the bellies that it needs to get into, because the people that need it the most are going to be like my Puna district or my Ka'u district, where the access to the hospital is impossible. And so that's a part of the communication and like kind of the storytelling that we're talking with the ledge and the reps and the senators, because the presence of the medication on island is one thing, but it actually getting to the patient is what I'm most concerned about. And, so we had a way that we were actually taking it to the patients, and it was actually, we've had a lot of good success. I mean, one woman within 3 hours got her taste back, and, she looked pretty sick when we first got there, and she was able to sit up a little, but I mean, it was a remarkable improvement, and we're seeing our direct supply cut off, and we're hopeful that with Department of Health, we're talking all the time, but our ability to provide this service to the rural patients so that we don't have to utilize the resources, we don't have to get them transported to potentially be, we were on a no divert on island for a long time, that we don't even want to put them there anymore. And so I think that's part of our stress for this week.
For this week.
Yeah.
And I just want to say, as talking to an infectious disease expert, Dr. Bello, earlier within the last couple of weeks, that Regeneron is really a medication that I'm told is used for people who are pretty severe, but not severe enough to go into the hospital. They're not on oxygen. Yeah, mild to moderate. Yeah. Sorry, I shouldn't have used the word severe.
For high risk.
Mild to moderate.
You're not fixing
not
anything.
on oxygen, right? But it's supposed to do it within about 10 days of symptoms. If you're really mild, you don't need this medicine. And so I just want to say that sometimes just isolation. However, we kind of don't know who's going to turn.
But I think that was the important part, right? That's the important part with having the subject matter expert. That's why, like a provider, I'm a provider in the field, so I can evaluate them. So, and the difficult thing is those criteria, it was good for, for people, our standard ambulatory patients, but it wasn't working out because, for a majority of times, because we just don't fit the, so then I think that's the value of having the ability to clinically observe people in the field, whether it's telehealth in some future moment, but because this is not the moment for those check boxes. It's not working. And I think, and I can tell you that that's my contribution from the front line is this is not a checkbox moment. We don't have the resources. And sometimes I had to treat people on oxygen because.
Sure.
Yeah. And I think that's
because you do.
Yeah.
And that's really important. And I know on the Queen side, Dr. Akaka, we use a hotline to care for our COVID patients and who are possibly able to get this Regeneron, and using a telehealth model, we are able to give or see if it's needed.
Yeah, you're correct. If I could just give a little more information, yes, and we call it the COVID info line, and the number is 691-2619. But what it is it gets to usually these are RNs, receiving the calls, and they have a system that they can escalate things according to what the screen or the questions are, and they could get it to a physician, or others who could with their checklists, which would factor in the comorbidities or what kinds of illnesses, and basically it's for the ones who are at high risk for getting admitted, right? Because the thing about the Regeneron or the Regen COVID or these monoclonal antibodies is to prevent the admission and to prevent the ER visit. If we can kind of prevent them getting that sick, then that would be a good thing. If they do get that sick, then they could get sicker. They could get respiratory failure, end up on the ventilator, and they could end up dying. Also, I believe that if they get sick enough to get to a ventilator, it's going to take them a long time after that to recover. So they might get well enough to be discharged from the hospital, but it might take a long time. They'll be always a little winded. They fatigue more quickly. They cannot walk up the stairs. They cannot take care of the mopuna quite the same. Of course, what I'm going to say then is please get vaccinated, because we want to prevent these things. It's not everybody's going to get that sick, but do we want to be the one, or do we want our loved ones to be the one who either dies or is so sick that they become bedridden? And for heaven's sake, if we are the breadwinner and you can no longer do your job, then I just shudder to think what it means to the family and the financial situation and such. And I think for a breadwinner, if it's young men and such, then that's a reason to consider getting vaccinated too, because you have to support your family.
I really mahalo you for that, because that was actually a follow-up question I had for you in regards to how do you tell your family to get vaccinated and why, and what are the things that we can do to help others to get vaccinated. So thank you for sharing that. And maybe Dr. Dang Akiona has some other really strong words that we can use for our families, or both of you.
Yeah, well, I'll finish real quickly, and then Dr. Dang Akiona, I know she sees it too. You know what? You would think that it would be easier in your own family, right? But we know better than that. It's not that everybody does get vaccinated, and then it's a thing of listening and grit your teeth, but you respect that. And you just try to be there and speak to them in a way I think that is kind, yet leaving the door open if it is about vaccination, because there are strong feelings and there's some work that we can do to communicate. And there are things that I think are when they say about misinformation, it's really managing all of that, and then managing the trust, and also being caring for the person, the family member or the patient. Dr. Dang Akiona, what do you think? You see it out there a lot.
I think, yeah, and we're kind of reflecting on that, because it's a lot of what we do right every day is trying to convince somebody to make lifestyle changes. So this is kind of our jam. And so it's like, the fear tactic doesn't work for everybody. The guilt tactic doesn't work for everybody. And so like I'm finding what's most successful is just kind of letting people talk to me first. And then, I hold a pretty hard line, because once my friends started having kids die in the hospital, that was the end. Like they said, this is not time to be nice. This is time to really, use that education you got, and better, and this is not okay. And they did the whole Hawaiian thing. Like as a Hawaiian, that in the history of all that's written, that your queen, your ali'i would have wanted you to stand up and say something. We've suffered enough, and it was a full she was right. And it's just one of those, like, a lot of times it's uncomfortable to disagree, especially with like a sibling or my auntie, like people that I'm close to, but we have to, so it's just kind of, I feel like we've been able to convince people, It was just being respectful, like not letting it get, nasty or anything. And just like, you're still going to be my sister. You're still going to be my auntie. But I really, really think like if when you think about all the things that my great grandma is still alive, she's 96. And like, if you think of all the things that grandma had to live through for us to be here, and like, we're super fortunate. We have a really nice life. And so I'm like, I tell her, I look at the patients in the hospital, and it's a real first world kind of moment when you can realize that all those people had turned down the vaccine at least one time, and they still get the best care, and I'm not holding anything against them. It's just that's the reality of where we live in this time. We are able to decide to be reckless, and I will still save your life. Like, I will still do everything I can to make sure that you're okay. And there are places where they didn't even get offered the vaccine once yet. So, it's kind of helping. It's a perspective thing, I think, part of it, because a lot of us have that fear, and then just recognizing you can be scared, but it doesn't make this fact wrong. Like, the fact is the vaccine is safe, and it's part of our toolbox, and it's part of something that we can do for the greater Lahui. And it's something that, like, it might be uncomfortable for me to disagree with you, but right is still right and up is still up. So, I'm still saying get the vaccine. And some people, we might not reach everybody, but there are of the few on the fence. And then that, those are the people that we're making. That's why we do what we do, and we go out to the community and we try to bring the vaccine to the people, because it's not that they're against it. It's just, we got to figure out where they're at and use our primary care hat and help them see that it's about, like, valuing you as a human being just as much as I love my mom and my daughter and my mentors. You matter so much that I'm gonna argue with all of these people.
Thank you, both of you. So mahalo for that. I really think that those are really strong arguments for all of us to use as primary care physicians, as people, as mothers, sisters, brothers, everything, but helping people to do that, because prevention is the key. Dr. Akaka, I do have a question in the chat for you, and it asks you to address the comment in the recent revelation in the public about the state's emergency crisis medical plan. Is it really culturally appropriate? So as a Native Hawaiian senior, this person feels pretty expendable. Can you please comment on that? So sorry, you're on mute, Kalamai.
Mahalo. Yeah, that is a question, and it's a tough one. First thing I'd say is, if not vaccinated, please get vaccinated, because the thing is, how would we get to that level of being so full that we don't have enough ventilators or resources? It's because plenty of people not getting vaccinated and they're getting sick. And I would say this, that at Queens, basically, I mean, it's like 87%. So I would say 9 out of 10 patients at Queens did not get vaccinated. And I'll say it again, the 9 out of 10 at Queens are unvaccinated. So if the question is, how can we avoid getting to the conversation about making such decisions? And that's to not get to that point. Prevention, and people, if they protect, they have aloha for others, they protect themselves. If they get vaccinated, do everything to prevent spreading COVID and such, then we're not going to be close to that conversation. But the thing is, we need to look. If we see the tsunami coming, we need to prepare, and we need to prepare for the worst. We hope it never happens. But we cannot get to the thing where the tsunami is upon us, and then we have to figure it out. It's much better, and it is our kuleana to have a plan. And I know it creates anger, but if we have a young person and an elder who has lived a full life, I don't want to make excuses, but it is looking at as many factors as possible. And I wasn't part of the conversation, but I think there's all kinds of ethical issues, and this is an ethical question. I think, and not to make excuses and not to defend them for making those decisions, but I think that if it is our kuleana and we have like 5 people who need ventilators and only 3 ventilators, then it's better to prepare now for it, so that if it does come to that time, then we have a plan and we're not being biased, and we're as fair as possible ahead of time, and we're letting people know. And again, I hope that people get vaccinated, because it is possible to avoid that outcome. We really can.
Mahalo, that person who actually put that in, just FYI, has been vaccinated 3 times actually, wears their mask and follows all the guidelines. And so thank you for that. A really difficult, I think, time and thing to think about and talk about. Dr. Dang Akiona, you wanted to say something on that?
No, I think that's a difficult, it's a loaded question, because when you really look at it, when you're getting to crisis standards of care, there is nothing in any way like, that we, as any culture, that it would be appropriate. And then the idea being that, as the people, I think now would be the time, while you're at home safely, socially distancing, wearing your mask and staying away now that you're vaccinated, to really engage again in the process for politics, for your legislators, and to just let them know what your concerns are, because the reality is we are here partially because our infrastructure isn't as strong as it needs to be. And so, we are there were things that we maybe could have done better. And, we just have not had any time to even look back and process what's already happened. I mean, this current surge is way bigger than what we had before. With Delta really, really changed things. And I think, we are facing, like in Idaho, where they are having to make very difficult decisions, and we don't want to be there. But, the reality is, for the outer islands, a lot of things kind of fall apart before, when we cannot, if Oahu is full, we have nowhere to go. And so it's one of those things, like, I think now is a good time to kind of have that conversation. Let's think about it. We need to invest a little bit more in public health. I mean, the Department of Health, over the course of my professional career, has had a lot of funding kind of taken away. Similar with Department of Education, right? You're seeing a lot of the effects of decisions made generations ago, and now it's really affecting the health of our people. It's putting specific groups at risk, and it's really impacting our ability to provide good care. And I think this is something, I think if anything, like Dr. Akaka was saying, COVID put spotlights on things, right? And I think it kind of clarifies where we need to rally and advocate. And one of the things is making sure that our public health infrastructure can respond, because this isn't going to go away, and this isn't going to be the only pandemic. It's going to happen again. So let's not let this happen where we're on the brink of it again. Yeah. And so now that we all have time, let's all read up and get engaged, because everybody should be staying home. So let's just do some homework.
Exactly. I just had a couple of questions that were in the chat. Dr. Akaka, do you know that the Queen's COVID hotline, I put it in the chat, is that number good for Big Island as well? Or is that strictly for Oahu?
I don't know, but I
don't know the answer either. That's why I'm not sure.
I would say call. It hasn't come up on the Queen side, whether neighbor island or not, and I don't know if the outer islands have this kind of resource. So I think if there's any doubt, then call, because they can say if can help or not, or help navigate. So yeah, if any doubt, and if you have need, then call.
Yes, and so the question was, is Regeneron available on the Big Island? And I know Dr. Dang Akiona already mentioned that Premier actually has been able to, go ahead.
and North Hawaii. So North Hawaii Community Hospital has it with Dr. Dworkin. So they have standing clinics that you can get referred into, and that you would go to the hospital for that. And then for everything else, they're just referring to us.
So most likely you can use that phone number. They probably have a referral line to
Yeah.
North Hawaii
Oregon.
number, and that way you can get cared for. I hope I'm speaking the truth, but that would make sense to me. So, and if not, I will call them and find out why
Yeah.
they're not doing that. So don't worry, I'm one of the new Queen's physicians anyway, in a new role as of this Monday. So thank you. So you should be able to use that same number, Kapua. Yes, you are welcome. And I think Dr. Dang Akiona already answered this question, but I think it's really a good one. So I'm going to just bring it up. And the question is, can you get the vaccine even after you're tested positive? Because, you know, people were told, or, you know, some of the rumors out there is if you were infected, then you really don't need the vaccination. And Dr. Dang Akiona really states that you really should get the vaccination even after you have tested positive. So please know that that is a myth, that once you get it, you don't need it again. Not for COVID, different for other infections, not this one.
We saw the COVID antibodies dropping off pretty quickly, and we couldn't predict with any like certainty who was going to maintain their ability to keep their antibodies and their ability to fight it high. But majority of people, I mean, because we were doing the antibody tests before, like a year ago, it would just drop right off. And so the jury is still out, but we're still saying, please get vaccinated. One of the baboozes that I took care of tried to say that he had a COVID, so he never need to wear face mask for 90 days. And that's not true. Gotta wear face mask. And then
can I also say that if you were vaccinated, you still should wear a face mask?
Yeah.
Thank you.
100%. It's all crazy. And then the third, I think the biggest other question was about that third boost and the booster dose versus the third shot. We are actually, yes. I don't promote the booster, but we do offer that third shot. So those are for the specific people, immune compromised, active chemotherapy, HIV, anybody who's immune suppressed, who probably didn't make enough of an antibody response. The first 2 shots, we are giving that third shot. There are people who are very adamant about their third booster shot. That would be in a sense be that you had enough response, but now you want to boost that up. And I'm more focused on getting the first and second shots into arms, but I am 100% like happy to engage in conversation with the people asking about the third. But we are doing the third shots, just not the boosters just yet.
Right. And perhaps that would be for people who are more immunocompromised than the average person, average lay person. We are pretty much out of time, but I wanted to just do a quick summary of what I heard from both of you. So from the front line, all of you are doing so much. Mahalo for taking care of the Big Island. I really hope that other islands have some other groups that are able to care for that, and for all that Queens is doing across our entire state. And what I really heard from you is caring for that vulnerable population is the most important, as we can care for them. And really, unfortunately, we actually are all vulnerable at this point. So I liked all the A's that you said: accountability, advising, to learn, education, anticipation, additional safety net support, and access to care. And I think those are the main takeaways from today, because it hits really on the front line, in the trenches, as well as if you're really needing help and you need to go to a hospital for this. We just want to mahalo all of you for really being part of our panel this afternoon. And really, I also want to add one plug. It is now flu season. So again, like last year, speaking of vaccines, please get your influenza vaccine. It is super important to do that, so that there's no confusion as to which of these diseases do I have when I go and see my primary care physician. So I'm just going to put a plug out there, as I'm also an internist, and I'm going to pass the mic on to Kim, so she can wrap us up and take us home. Mahalo nui, Dr. Dang Akiona, as well as Dr. Akaka.
Mahalo.
Mahalo to you, Dr. Carpenter, as well. Thank you all so much for participating in this panel. A lot of really good information that has been shared with our community. So mahalo nui, all really smart and firsthand experiences, and we appreciate all of that. I just want to say that thank you to all of our sponsors, to CDC, to Walmart Foundation, to our partners and CAPIP, Asian American Health Forum, and this is a presentation co-sponsored by Ask-A-Kauka, the Association of Native Hawaiian Physicians, by Papa Ola Lokahi, and NHPI 3R, so mahalo nui. Now, in my role with Papa Ola Lokahi, I'm going to share a few things that are coming up on our schedule. We have many webinars every week, all the time, and this is what's coming up. I think we're sharing screen tonight at 7 o'clock. Week 3 of Hawaiian History Month is focused on Ho'ola, and 3 out of 4 of the presentations have been related to epidemics, historic epidemics in Hawaii. Tonight we have Kala Domingo and Maka Malaysia, and they will share what they've learned about 19th century epidemics from Hawaiian language newspapers and other Hawaiian language resources. And then Dr. Martina Kamaka is going to be introducing Deanna Espinas and Lorenzo Di Stefano with a reading by Olivia Breitha, who was a patient in Kalaupapa, and she wrote a book of her story there. And so that's going to be very interesting. Starts at 7 o'clock tonight. We look forward to seeing everybody. We also are wrapping up. September is Addiction Recovery and Healing Month, and we've had many presentations over the last 3 weeks. On Tuesday, September 21st at 11 o'clock, Lahela Cruzy is a social worker, and Haku Ho'oponopono, she will be presenting at lunchtime. Great presentation. She's awesome to listen to. Also, September 21st happens to be World Alzheimer's Day. Kia'i Lee will be hosting this panel. Another really smart people. We've got a researcher, a caregiver, and a provider for patients with Alzheimer's. That'll be really good, and continuing education is included. On September 24th, next Friday, we've got a panel. The Native Hawaiian Health Scholarship Program is hosting a panel on Medicare and Medicaid and how to get people registered if they are not already registered. Lisa Ka'anoi will be hosting that one. We continue our Addictions and Recovery Month all the way up to September 28th, when we feature Kateri from a really amazing nonprofit on the continent talking about the Wellbriety movement. That's September 28th. And again, mahalo nui to Dr. Deanne Carpenter for moderating, to Dr. Martina Kamaka, who's in the background, for helping to organize these sessions, and to our really smart presenters today, Dr. You know what I love the best? I love how Dr. Dang Akiona said Dr. Carpenter was one of her mentors. And Dr. Carpenter opened up the session by saying Dr. Akaka was one of her mentors. So this is really a nice continuum of healthcare by Native Hawaiian physicians. So mahalo nui, eola mau, amau.
Mahalo. Kim, I think there was just one question as to where they can get a copy of this webinar online.
Great, thank you. It's on Facebook, 6 different platforms, not 6 platforms. Office of Hawaiian Affairs, Ahahuiona-Koka, Papa Ola Lokahi, NHPI 3R, Napu'uwai on Molokai and Lanai, and also the Native Hawaiian Center of Excellence, all cross-posted this live stream presentation. Papa Ola Lokahi will have it up on its Vimeo page within the next 2 or 3 weeks. And we'll let you know. Mahalo for asking. Again, mahalo to you all, and aloha.
Aloha.